Thank you, Madam President. I also rise to give my no vote explanation. Fundamentally, I believe that the access to health care is a right that should be protected for all of our citizens, which is why I was such a strong supporter of the Healthy Michigan program from the outset. From my perspective, the right to access health care should not be predicated on the number of hours a person works per week. But if we were determined to attach a work requirement to this program, as it seems that we are, then I believe that it is critical that we are thoughtful about it, that we do it in the best way we can and cause the least amount of harm to as few people as possible. According to the University of Michigan Institute for Healthcare Policy and Innovation, about 3 in 4 of all Medicaid recipients in Michigan are already working. Of the remaining 1 in 4, when asked why they were not working, 1/3 said that they themselves were in fair or poor health. 2/3 said that they had a chronic physical illness. 1/3 said that they'd been diagnosed with a mental illness. And 1/4 said that they had a physical or mental impairment that interfered with their ability to function in at least half of the days in the last month. Let's remember a little bit about the jobs that we're talking about. The nearly 2.5 million Michiganders who are receiving Medicaid and Medicaid expansion benefits in our state are eligible for these programs because their income falls below 133% of the federal poverty guidelines. That's approximately $15,800 for an individual and $32,300 for a family of 4. We know that the jobs at this income level often come with irregular, erratic schedules, which create even more challenges for these individuals. When asked, more than 2/3 of people working variable scheduled jobs report that the schedule interferes with their family life. Over 40% report that the unpredictability causes issues with their child care or parenting responsibilities. And 63% say that their scheduling issues causes negative health impacts, which I think it's fair to assume would only be exacerbated by a loss or threatened loss of their health care coverage. This is what we know about the people who will be affected by the policy changes before us today. But colleagues, here's what we don't know. We don't know how much this policy is going to cost us to implement. We don't know how much it's going to cost our state budget annually once it goes into effect. When we implemented the Healthy Michigan Plan, we included a provision that said, if and when its costs exceed savings, it should be dissolved. I would argue that the same should be expected for work requirements. If they ultimately are not saving the state money, they should be discontinued. What we have found is that providing people access to health insurance has not just improved health, it's saved them money. It's saved hospitals and health systems money because they aren't having to offer as much uncompensated charity care. And it saved our state money because ensuring that people can get to the doctor before they have an advanced stage health care crisis turns out to be a pretty good deal for us. I'm disappointed that we're about to partially renege on that deal today by implementing work requirement programs without ensuring that the barriers that keep people from the ability to meet those requirements are being addressed. Unless and until we tackle the challenges of childcare access, transportation, job training, work placement, and so much more, what we're doing is setting up a system that's not designed to keep people healthy, and it's not designed to put people to work. It's just designed to keep them from accessing health care. And it's for that reason, all these reasons, that I will be voting no today, and I encourage my colleagues to do the same. And Madam President, I would like my remarks printed in today's journal. Thank you.